We are being joined by a local expert from the Henry Ford Hospital, System Medical Director for Weight Management and Obesity Medicine Medical Director, Dr. Suki Singh. Thank you so much for joining us on The Splash.
Thank you for having me. Good morning.
Thank you, thank you. So we are talking about this article, this story that talks about weight loss drugs like Ozempic kind of affecting the bones. Essentially, what have you gotten out of that story?
Primarily the story really focuses on the side effect rather than the benefit of the medications. The age group that was in this specific study was middle-aged women in their mid-40s to mid-90s, and that's already a higher risk patient for osteoporosis or brittle bone disease.
Right.
So it's very difficult to make the generic statement that there is a higher risk for everybody. Yes, for specific age groups, certainly there is.
See, and we also saw a few different articles that talk about different situations that our residents right here in Oakland County and West Bloomfield are dealing with. It was an article from Bridge, Michigan that says 1 in 5 Michigan kids are obese and doctors are turning to weight loss drugs to kind of to combat this. What would you have to say in regards to that information?
Obesity is becoming a more prevalent disease, and we do need to focus on the treatment and the prevention rather than ignoring the problem. By the year 2030, 50% of the U.S. population is going to be struggling with obesity. So we need to be prepared for this that's upcoming in the next few years. Weight loss medications have a great spot for the disease treatment. Anti-obesity medications can help correct a lot of the hormonal dysregulations that prevents one from being able to adhere to a diet plan or a healthy nutritional diet or exercise because of food cravings, because of larger portions of meals. So these medications are actually quite useful if used correctly.
And joining us right here on The Splash Live from Henry Ford Health, System Medical Director for Weight Management, Obesity Medicine Medical Director for West Bloomfield and other Metro Detroit areas, Dr. Suki Singh. Joining us just talking about medical weight loss drugs and how it affects local residents. Now, we're also getting from the Oakland County Health Department just information regarding our aging population right here, specifically in West Bloomfield, and having the challenges of arthritis. Can you just talk about any specific strategies that local residents can adopt to manage arthritis and manage the risk of hospitalization?
Certainly, arthritis, is an inflammatory disease. It's a damage to the joints from weight-bearing joints. So whether it's your knees or your hips. So one of the first things you could do is be at a healthy weight, decrease those inflammatory foods out of your diet, try to stick to more of a healthier routine where you are doing regimented strength training to really make your muscles that are supporting your joints more strong, which will also prevent future falls and risks of falls that we see in our aging population.
Yeah, so we're seeing like it's like a double-edged sword. And I want you to correct me if I'm wrong. Seeing that if you are obese, you're suffering from obesity, it kind of puts weight on your bones, which makes your bones a little bit weak. And also, if you're kind of using weight loss drugs as a solution to your obesity, that also affects your bones. So it seems like going the way of pretty much exercise and a healthy diet is the best solution overall. What would you speak to that?
Couldn't agree more. Both of those things have one thing in common, and that is strength training, a healthy routine. Whatever you can do 3 to 4 days of strength training, 15, 20 minutes. You could do resistance bands, light weights throughout the day to prevent these side effects and actually get the best benefit of these medications.
Correct. Now, like I said, coming from the Oakland County Health Department, it seems like there are a few different bone issues that are being discharged from our local hospital residents in the Oakland County area, 65 and over, over 500 hip fracture cases, and this is from 2020 to 2022. Osteoporosis mentioned, 65 and over 3,000 cases, 45 and over 1,800 hospital discharges due to arthritis. But speaking on the hip prevention, are there any targeted initiatives that can be implemented in West Bloomfield to prevent hip fractures amongst the elderly?
A great topic of discussion. Again, I always go back to what can we do to implement more exercise, strength training, make sure our elderly population is feeling more at balance with their joints. That can prevent risk of falls and further damage to a joint from a fracture itself. So if we could do more exercise classes, I'm always a big proponent of yoga, resistance training. Whatever we can do, whenever we can do it is key. Having more food markets with healthy fruits and vegetables accessible is also helpful. It really just comes down to preventative.
Completely understand. Now, overall, since we are making a connection between weight loss drugs, bone density, and how it affects local residents here in West Bloomfield, how should patients using weight loss drugs, GLP-1 drugs for weight loss, or diabetes medicine or management address the potential risk of bone density loss here in West Bloomfield?
Again, strength train as much as you can, 2 to 3 days a week at minimum. If you can do it every other day, that's fantastic. And I do want to also talk about these medications have been around over 10 years, but now all of a sudden, when they're being used for treatment of obesity, we're bringing out all the side effects and the risk factors associated with these medications. So I want to make sure patients are understanding, if done correctly, you can use these medications for your benefit,
Okay.
and you can actually do well over time and make your joints more stronger with the right type of exercise, right type of nutrition. So work with a dietitian, work with a program that can help support your lifestyle.
I completely understand it, and we appreciate that. Has there been any other key information before we let you go that we haven't discussed that you want to let our community know about in regards to family medicine or obesity?
Oh, certainly. I could talk all day about obesity. It's a disease that we need to start treating instead of ignoring and telling our patients that it's a fault of their lifestyle. Things happen, and it's what we can do for our patients. It's how we can help them lose the 10, 15, 20 pounds, get into a healthy routine with their eating habits, exercise, evaluate them for anti-obesity medications. And your diabetic patients, use your GLP-1s instead of insulin, and really help support the disease of obesity and prevent the complications like diabetes, fractures, arthritis, cancers, Alzheimer's.
Correct, correct. And that's like we said, we learn about information right here in Oakland County and West Bloomfield about not only our aging population, but the number of cases that we see with discharges from bone-related issues. We want to make sure we put out correct information from experts like yourself. Thank you again for joining us right here on the Splash Light, System Medical Director for Weight Management and Obesity Medicine Medical Director for West Bloomfield and Henry Ford Hospital, Dr. Suki Singh. Thank you for being here. We appreciate it.
Thank you so much.